Dentists pay me thousands of dollars to train their front desk team, and I'm going to go over exactly the process that I teach their front desk to get an 80+% conversion rate for new patients over the phone. And so we're going to start with a new patient phone call. I left a note here. You don't move the standards based off of your worst patients. When you are answering the phones, sit up straight, give your best energy, and take it one phone call at a time. So starting off with, you must answer the phones all the time. A goal for the office should always be a greater than 90% pickup rate. It means that you guys are killing it. If you're under, there are things that you can do to improve. So you start off every single call with, thank you for calling XYZ Dental. This is blank speaking. Who do I have the pleasure of speaking with? What I call this is the data collection and authority framing. And what this is you start by setting the tone of the conversation. You start by asking questions. The front desk is in charge and you are to guide the decisions for the patients to eventually schedule. So you break down into two different decisions. They either don't have any immediate questions up front, or they ask you some sort of landmine question about pricing, insurance, second opinion, or an emergency, right? So you go into it. If they don't have any immediate questions up front, it goes, nice to meet you, name. In case we get disconnected, can I get your full name and a good callback number, please? Caller IDs almost never match up with the name of the patient. So you want to get the first name, last name, full phone number in case you do actually get disconnected. And on the other side, it's you don't want to answer that question immediately or else you're going to lose the schedule. You answer with acknowledgement, happy to help you with the problem that you asked. In case we get disconnected, can I get your full name and a good callback number? Imagine you're calling the bank. They always ask you for your account number. They ask you for your last four social before you guys even have a conversation. Treat this the same. And afterwards, add a little personality in there. Thank you for that information. Oh, and how did you hear about our office, by the way? When you're doing marketing, it's important for you to get a clear picture of what the attribution looks like. You want to know how many referrals you're getting. You ask this question to figure out where is the source of traffic. It's not 100% correct, but it's always best practice. So this section is going to be data collection and authority framing. Remember, you are a consultant over the phone. Your front desk is a consultant over the phone. You're not an order taker, right? So we move on. The next section is going to be discovery and rapport building. I emphasize this so much. This is the reason why most dental practices have a low conversion rate, because they go on to answer the questions as soon as they come in. If they don't have any immediate questions up front, you answer with, appreciate it. Thank you for telling me all of that. Tell me, what kind of appointment are you looking to schedule? Are you looking for something like a cleaning or an exam or something more specific? And on the other side, okay, I know you wanted to know a little bit more about pricing on a crown or something like that. Can you tell me a little bit more about what's going on and what you're looking for so I could best answer your question? Right? So now they give you context, they give you more story, it gives you a narrative to build off your responses with, and it helps you build rapport with the patient. So then you see this decision tree, it goes into it. It's now going to be hygiene. This is up for the front desk to decide, hygiene or doctor schedule, hygiene or doctor schedule, right? And then this, as a side note, I'm going to weave this in here. It's going to be start building value very early on in the practice. Let's work through it. They answer, hey, I haven't had a cleaning in a little while. I just want to be up to date with my preventative care. Understood. Happy to help you with that. Happy to help you scheduled. When was your last dental cleaning and checkup? Is there anything that's currently bothering you? They're going to mention something like, okay, it's been like a year or so. I don't know what's really bothering me, but I feel like I have a couple cavities. Okay. Okay. Yeah. We help patients all the time. This is weaving value statements in here. We help patients all the time who are overdue. Don't worry about it. You're not the worst one that we've seen, right? Makes them laugh a little bit, makes them feel better about what's going on. If somebody is looking for something specific, it's like, hey, like I have pain in my teeth. I think I have a couple of cavities. I'm overdue for some treatment. It's been a little while. Okay, can you tell me a little bit more about what's going on? Which tooth is bothering you? Do you know what you need for it? Have you spoken to a dentist about it? Do you have x-rays that you previously done? Right? I'm so sorry to hear about that. You want to be empathetic. Ask them, how has this affected them? Oh no, I'm so sorry. The goal is to ask them enough questions to make them unsure about what the solution is and have the only solution be for them to come into the office for a consultation. Now, this connects to the landmine questions. Okay, I know you mentioned this specific question. Can you tell me a little bit more about what's going on so I could best answer your question? They're going to tell you, okay, yeah, I went to another doctor and they told me that I needed 2 bridges. And like, I originally, my previous visit with this doctor, everything was good and I'm just a little bit worried. Okay. Do you know which tooth it is? Can you tell me what's going on? Find out the concern, right? If it's hygiene, got it. That totally makes sense. It's been a little while since your last dental visit. You're looking to get a cleaning. When was your last dental visit? Is there anything that's currently bothering you, right? And then, so I put this here for you to be able to, after hearing what your concerns are, to plug in the value that your practice has for the patient's specific needs. After you get that, you have to restate the problem to them so that you know that they know that you understood their situation. So you say, hey, let me just make sure I have my notes right on your situation. It seems like this is the problem, you had this problem, and what you're looking to do is solve this problem, and this is your dream result. Does that sound about right? Well, Dr. X or Hygienist Y helps patients like you all the time. We are known for thorough cleanings. We work with anxious patients who love us, and or we're a pros office or a cosmetic dentist, and we're really great with solving these problems. So then you're reinforcing values into the practice. You're reinforcing that your practice is best positioned to help the patient achieve the dream result. And on one side, you are helping them make the decision to schedule, which they're open to. And on the other side, you're going to give them reasons why price or insurance or whatever the problem is that they position to you is not actually the main concern. So if there are no landmines at this point between the schedule attempt, as in there's no, I need to know the price before I schedule. I'm looking at the schedule right now. Does X time or Y date work better for you, or does Y time on X day work better for you to come in? We call this the assumptive close or the dual close. You give them two options to choose. If it doesn't work for them, they'll give you a third option because we're in the business of choosing right now. And if there is a landmine question, it's usually going to revolve around pricing or insurance. And so what pricing is going to look like is, hey, so finally, after saying everything that I've said, I've restated your problem, and we're positioned to help you with your problem. So to answer your question, since the situation is restate the problem of what's going on, and we're not really sure what it is that you need, you don't have x-rays, you don't have a treatment plan, and it's been a while, let's schedule a consult with the doctor to figure out the exact situation so that we can get you to the dream result that you're looking for, and we'll give you the exact pricing that you're looking for. I'm taking a look at the calendar right now. Does the time X on Y date work better, or Y time on X day work better for you to come in? And so I put a little notepad here above. This is where the free consult or hygiene offer shines. After selling the shit out of your practice, providing all the value and knowing exactly what the patient is going through, and they sound serious and they sound good over the phone, how good is it for them to come in without paying a singular dollar out of pocket, truly solve their problem? You're actually solving something for them when they come in. When applicable, mention affordable financing options to fit their budget. And if applicable, if you guys have a membership plan or something like that, let it be known and talk about that at this point, because you've gone over who you are, what you're looking for. Let me understand what you're looking for. And I do. Here is what I would recommend for you based off of the situation. And does it sound good or not? And then you just leave it up for them to choose, right? And you always ask for the schedule. So if it's about insurance, hey, look, if you don't accept their insurance, the way to respond to that is, hey, a lot of our patients actually have this insurance. While we're not in network with that insurance, they usually opt for our membership plan, which is really affordable. It covers all of your cleanings, it covers all of your emergency visits, and also gives you a discount on any treatments that you're looking to get. So insurance, we have a lot of patients in general. If you do accept their insurance, then you go, hey, we have a lot of patients with XYZ insurance. What our process looks like today is that we'll set you up with an appointment to solve this thing that you're looking to solve, and we'll have our verification team look at your insurance before or at your visit so you don't have any surprises. Okay, awesome. So I'm taking a look at the calendar right now. Does time X or time Y work better on Y time, or X day work better for you to come in? You always go for the schedule. If you don't ask for the schedule on the new patient call, you are missing the goalpost, okay? So I named this section, I call this the scheduling expectation setting. This is really important because this will affect whether or not your patients show up. A large portion of the discovery and rapport building plays a huge role in it as well. After scheduling for the pricing, right, you're like, okay, this day works better for me. Okay, awesome. So what I'm gonna do right now is I'm gonna finish your patient profile. What is your date of birth? What is your zip code? So on and so forth. If applicable, do you have insurance that you'd like to use towards this visit? Awesome. And depending on your office, you have discretion on how to handle it. On the insurance side, okay, that works. We'll get you scheduled. Let me just finish your patient profile and you're all set. Do you have that insurance information with you? Take that, you collect it, you let them know, right? And then finally, after they're scheduled, you go into, hey, you're all set. You're going to get a confirmation shortly today for your appointment at X time at Y date. I blocked out this much time for your visit and we've added your concerns to your profile. Typically, this is what you can expect during your visit. You'll meet Dr. X or you'll meet Hygienist Y. They are wonderful. If I can ask you for a small favor, if anything changes in your scheduling, please let us know so that another patient can be seen during that time slot. You'll get a text or a call a few days before to confirm your visit. We're located at XYZ Street and the parking looks like this. We're excited to meet you at X date at Y time for the close. Done. Simple. What you'll find is that all of these calls, because they're structured this way with the questioning this way, they'll all look the same. And so the most important part is following it in order. Data collection and authority framing, discovery and rapport building, value creation, and going into scheduling plus expectation setting. One thing that I always talk about in my videos is finding the deeper reason why. If you look at this, most of the time is going to be spent here going over and clarifying what the problem is, what their situation is, how things have affected them, and what they're looking for. And the goal here is to know exactly what they're going through, summarize it, repeat it back to them. And that's what it means to have them feel understood as a patient. And if you can hit this every single time over the phone, your schedule rate will go up. And then if part of your team is just, they never get to the point where they schedule, you have to reinforce the fact that your team needs to go ask for the appointment. So this in short is how I would approach phone calls with the dentist that I work with. Almost all of the phone calls look like this. They take around 4 minutes minimum. It takes time because they're trying to go fee for service or they're trying to go out of network. It takes time to build a relationship with the patient, and this is how you create a great experience.